next presenter, Dr. Bharat GURNANI.
There were 4 sessions. This is the 4th one, so we have to enter the finalist.
Good afternoon, respected judges, and good afternoon, everyone here. I'll be presenting my study on innovations in corneal ulcer diagnosis, evaluating the multimodal ChatGPT model using entry-segment images. It's a simple study done on AI-based model. I have no financial disclosures or conflict of interest to make. As we all know, corneal ulcers are a significant cause of morbidity and vision loss. The etiology is diverse, including bacterial, fungal, viral, protozoal, and sterile inflammatory processes. Complications can result such as stromal necrosis, perforation, endophthalmitis, and can result in blinding sequelae. Early and accurate diagnosis is therefore crucial to give correctly timely treatment. And traditional modalities rely on slit lamp cultures and PCR-based diagnosis, which require trained personnel and well-equipped laboratories. So artificial intelligence has recently emerged as a promising tool for disease diagnosis, screening, and management. Deep learning models have also demonstrated high accuracy in diagnosing diabetic retinopathy, glaucoma, AMD. AI applications have expanded into various pathologies and entry segments such as keratoconus detection, corneal topographic images. However, the application of AI in corneal ulcer diagnosis remains an evolving area with limited availability of large, well-annotated datasets to train supervised models. The purpose of my study was to analyze the diagnostic performance of ChatGPT in classifying ulcers using AS anti-segment images and to assess the accuracy, prediction, precision, sensitivity, specificity of model in classifying anti-segment images and to classify the ulcers into various etiology and to determine whether this model can achieve clinically relevant diagnostic accuracy without prior fine-tuning. It was a retrospective study done during Jan to June 2024. I took 300 images from my AS anti-segment ocular surface disease dataset, and the model was ChatGPT. Images were uploaded into ChatGPT 4 model, OpenAI model, and all images were converted into 512 to 512 pixels in the RGB format. And ChatGPT images were, its multimodal capabilities were leveraged to analyze and classify the images. And the AI model was tested in zero-shot mode, meaning that it solely relied in its own inherent training knowledge without external access to any ophthalmology-specific image dataset. So the binary classification was used whether to classify the ulcers into likely corneal ulcer or non-corneal ulcers, and image was uploaded into the format, and confusion matrix was constructed, and also the type of ulcer was evaluated. So this is an example how the image was uploaded, and the question was asked whether it's a likely ulcer or non. And next, the etiology was also calculated. The etiology was also deduced from the model. So the accuracy of the data set was 85%, the sensitivity was 60%, the specificity was 90%, the precision was 55%, and the F1 score was 0.57. And we constructed the confusion matrix, which looked like this. There were 90 actual corneal ulcer cases, which were predicted as true corneal ulcers. The true positive were 90. The actual corneal ulcer cases, which were there were 60 actual corneal ulcer which were predicted as non-corneal ulcer. The false negatives were 60, the false positive were 15, and the true negative were 135. So there was actually a total of 150 ulcers and 150 non-corneal ulcer cases out of the anti-segment database. The ROCO curve was calculated, and the area under the curve was 0.8, suggesting good overall diagnostic performance. The model performed well in excluding non-ulcer cases as well. Out of the data set, the bacterial ulcer constituted 50, the fungal were 40, viral were 25, and acanthamiva were 15, murans were 10, and neurotrophic ulcers were 10. And we also break down the misclassified corneal ulcer cases. There was 45% cases which were severe infiltrate and hypobian were misclassified. Corneal ulcers with vascularization, false positive were 20%, and stromal haze and subtle epithelial defect were 35%. So coming to the discussion, findings of this study demonstrate considerable potential in diagnosing ulcer. The model exhibited good diagnostic accuracy, specificity, and sensitivity. This suggests that LLM models may have inherent ability to process visual information and to give diagnostic interpretation. It lacks task-specific training on ophthalmic images. Previous studies have used in AR in diabetic retinopathy, glaucoma, keratoconus, fundus photography screening, but in entry-segment images still largely unexplored. Lee et al. Imaged 5,000 patients and give 92% specificity. Zhang et al. 87% sensitivity. In comparison, our model performed very well. There were few limitations like high false negative rate, stromal defects and epithelial defects were misclassified. Chronic ulcer with vascularization show high false positive rates, and the ulcers were misclassified, some ulcers were misclassified. So coming to the take-home message, the study demonstrated that ChatGPT achieves an accuracy of 85% with high specificity, but moderate sensitivity in identifying ulcer cases using ASI images. The model's ability to exclude non-ulcer cases suggests application in screening and triage settings. The higher false negative rate highlights the need for further optimization before real-world implementation. Compared to traditional model, ChatGPT perform competitively in specific time, but require fine-tuning. And further research focus on integrating ophthalmology-specific data and multimodal input and hybrid AI model to enhance diagnostic performance. Thank you.
Yeah, nice work. Wanted to ask you, is there any number of images which will be required for, improving the sensitivity and specificity? Because you mentioned one study had 3,000?
Yeah, there were like around one study at 5,000 images, other study at around 3,000 images. So, but these studies had they have these scientists or the researchers have designed their own softwares to based on various parameters to understand the ulcers, whether they are able, and they have classified the ulcers with, and they have compared the ulcers with the human inputs as well. I just took the ChatGPT simple model to understand whether is it able to give us, since there is a boom of AI and a lot of people are using regularly these large language models. So I wanted to understand whether it's really helpful or whether it gives us some inputs to understand and can reduce the burden and can, like, whether we can rely, a general or common man also can rely whether it's ulcer or not. So I had around 300 images. So I took a good considerable set of patients or images to understand whether, like, it gives a clinically relevant understanding whether is it able to predict or not. If the image there were too many images, maybe we'll get more understanding about it. So maybe a large data set will give us more information and better understanding of this matter.
In fact, how you could have taken your images, even 300 of them, and done a, made the AI deep learn.
Yes,
Because deep learning itself would have trained the AI for the 301st.
understood.
That's how it
Yeah,
usually
it's a
works.
like
with,
next level of training. Like you need some
no, you need
scientist
someone from
yeah,
the
scientific
engineering.
engineering
Yeah,
inputs. Yeah,
definitely.
we
But
need that.
they do the deep learning with surprisingly less number of images.
Yes.
If you have the diagnosis of all of these, that would be
Yes,
better if you can make it deep learn.
Thank you. These all images were taken by me only, and it was my data set only. So I thought like better to understand how it works, whether it really works or whether I cannot rely on this. But it gives good information that, like, based on probably the data has been built up by people over the years asking too many queries, and it got refined over the years. Since a lot of models have come up, earlier it was 3, then 3.5, now 4, now we have a fifth one coming up. So they are refining it, so it's giving more better information day by day.